Your knee pain advice blew up my comments. Some of it is gold, and some of it will keep you hurting. In the next few minutes, I'll show you one 10-second test to identify what's flaring your knee today and preview 3 fixes that actually reduce pain and rebuild capacity. Knee pain is one of the top reasons people stop training. The problem? Knee pain isn't just one thing. It's an umbrella. Patellar tendinopathy, pain right below the kneecap. Patellofemoral pain, behind or around the kneecap with stairs, sitting, or squats. IT band, related pain on the lateral side. Meniscus, deeper pain, sometimes clicking or locking. Arthritis, morning stiffness that warms up. Today isn't a diagnosis. It's education so you can make smarter choices. We'll grade comment advice from the comments as helpful, half-truth, or harmful. And I'll give you a simple decision path. Here's the idea that most posts miss. Load capacity. Tissues don't adapt to what you avoid. They adapt to what you can tolerate and then recover from. That's why ice or rest can calm symptoms short term, but rarely fix mechanics or capacity. Here's the plan. We'll do a quick self-screen to steer you toward the right fixes. Then I'll react to your most common tips with evidence and live demos. You'll leave with 3 starter moves you can use today. If you got locking, buckling, hot swelling, fever, or redness, or pain lasting more than 6 weeks, go see a doctor. Everyone else, let's get you moving better. Short rest can calm a flare. Long rest detrains the tissue and your mechanics. Pain often reflects irritability, not permanent damage. Tendons and the patellofemoral joint respond to graded load, not avoidance. Take a relative deload. Scale volume or intensity 20 to 40%, then rebuild with isometrics, slow strength, and functional work. Ice can blunt symptoms after a flare or session, but it doesn't restore capacity. Chronic patellar or patellofemoral pain improves most with progressive exercise, not cryotherapy alone. Use ice after sessions if it helps you train, but anchor the plan in loading and technique. Quad strength is crucial, especially for patellar tendinopathy and patellofemoral pain, but how you load matters. Isometrics can give you short-term pain relief. Eccentric or heavy slow work builds tendon and joint tolerance. Open chain is fine, but many do better starting with decline squats or step downs that respect pain thresholds. Think 5 sets of 30 to 45 second isometric holds at a moderate high effort. Then slow 3 to 4 second lowers in squats or step downs. You cannot lengthen the IT band. It is super dense fascia. Relief usually comes from relaxing the TFL and lateral quad and improving tolerance, not changing IT band length. You can roll on your TFL, not your IT band, and lateral quad briefly, 30 to 60 seconds, then strengthen your hip abductors and external rotators to reduce knee valgus. Sleeves can improve warmth and proprioception and reduce pain today, but they're not a long-term solution. Short-term comfort can increase adherence, yet outcomes track with the exercise dose. Use a sleeve while you run the loading plan we'll lay out next. Hamstring stretching helps only if posterior tightness is actually limiting squat or stair mechanics. Otherwise, it's not a fix-all. In patellofemoral pain, hip plus quad strengthening consistently outperforms stretching alone. Stretching is support, not the driver. So screen first. If you're stiff, add dynamic hamstring work, but pair it with hip abduction and controlled squats. Avoiding squats forever is harmful. Fear locks in weakness. The goal isn't to avoid squats, it's to retrain them. Patellofemoral stress is modifiable. Stance, depth, and dorsal angle all shift joint loads. Capacity grows with graded exposure. So start with shallower ranges and a more upright torso, then deepen as symptoms allow. We'll map through that progression next. All right, so those were your comments. Now let's sort your knee pain out in 10 seconds. Stand on a 25-degree decline. No edge, stack 2 plates into a ramp, or use some hooks. Do a single leg squat to a comfortable depth. If you have pain behind or around the kneecap with stairs, sitting, or squats, that's patellofemoral pain. If you have sharp joint line pain, locking, buckling, or hot swelling, pause and go see a doctor. First, we're gonna feel better today so that we can train. Isometrics can reduce tendon pain temporarily and prime the quad without a big joint shear spike. Set up a Spanish squat or a ball squat so that your shins are vertical and your torso is nice and tall. Hold 5 reps for 45 seconds at about 70% effort with 2 minutes of rest. Keep your pain at 3 out of 10 or less. If it climbs or lingers the next day, scale your range or effort. Now we rebuild control where most people lose it, the lower step. Step downs train controlled knee flexion with hip stability. Start with a 4 to 6 inch box. Keep your hips square. Your knees need to track the second to third toe. Quiet heel tap and 3-second lower. Do 3 by 8 to 12 per side at a 3-0-3 tempo. Progress by raising the box or adding load, but pick only one variable at a time to increase. If your knee caves in, that means your hip isn't helping. Stronger abductors and external rotators keep the knee from diving immediately and lower patellofemoral stress. Lateral band walks, 3 by 15 to 20 steps each way. Soft knees, straight feet, and keep your pelvis level. You can also do clamshells or cable abduction, 2 to 3 by 15 with a 1 or 2 second hold. Feel it in the side of your butt, that glute med, not in the front of your hip, which is your TFL. Tight ankles push stress into the knee. More dorsiflexion gives smoother squat and step mechanics and softer landings. Try this 3-minute ankle circuit. Knee to wall mobilizations, 2 by 12 to 15 per side, heel stays down, then calf eccentrics, 3 by 15 straight knee, and 3 by 15 bent knee. So here's your mini plan for today if you're irritable. Spanish squat or ball squat, 5 by 45 seconds, then step downs, 3 by 8 to 12, then hip band, 3 by 15 to 20, then the 3-minute ankle circuit. And you're done. Okay, now it's your turn. Which tip helped you most today? Drop a quick comment with 3 things. Where your pain lives, below your kneecap or around it, what lit up on the test, and which fix felt best. Spanish squats, step downs, or the hip band. I'll pull real responses and react to them in an upcoming video. Use the pain window, changing one variable at a time, and keep the hip and ankle pieces in. If you know someone who avoids the gym because of their knees, send them this video and help them get back under the bar the right way.